thought we already started.
Hey, America.
I'm in.
This is the Shift
Show. I feel like we need to sing it.
This is
Shift
the Shift Show. Okay. So today, I asked Em if she would be willing to get a little vulnerable with us.
I'm getting vulnerable.
Yeah. And we were having a conversation, was that yesterday? I don't know, someday, recently, about how... Okay, so Em had breast cancer.
Cozy blanket on so I feel safe during our vulnerable conversation.
Yeah,
I did. I had boob cancer. I refrained from hugging them right now.
Oh, that would be okay. They know you love them. So she had breast cancer, and
love them.
she had a... Okay, and when my sister was diagnosed, we were about to get a CT scan, and she said, I don't know what, like, I kept saying, there's so much more out there than what we know. Radiation, chemo, and surgery.
Mm-hmm.
There's so much, there's just so much. And she said, yeah, but I don't know what it is. Like, we don't know what it is.
You don't know what cancer is, or you know what
We don't know what
treatment
treatments are available.
Oh, yeah,
Like,
yeah,
just so
yeah.
much. What does that
Right.
include? Well, it includes sound and acupuncture and energy work and blah, 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 nutritional therapy. You know, there's like thousands of modalities that have been found to treat cancer. And so then Em said,
Treat and cure.
treat and cure. I mean, she's cured. She's healed.
I'm here.
She's healed.
Yeah.
And
Yeah.
and,
Yeah.
and then I asked you about certain physicians, and you said, I didn't feel comfortable in my post-cancer journey. Was that, or in your pre-cancer journey?
I mean, well, that's an interesting consideration. I considered myself cancer-free post-surgery
Okay.
because the way I defined it, I was cancer-free once I did surgery, chemo, radiation. Oh, no, I didn't do radiation. What the hell? What am I talking about? The recommendation was surgery, chemo, radiation, endocrine therapy, which is a pill. So once I had surgery, the margins were clean, and in my world, I was cancer-free post-surgery. So
Okay.
does that make sense?
Yeah.
So when I was talking, physicians that I was working with was post-chemo.
Okay. Okay.
Because what happened was I chose to stop chemo.
Why?
Well, part of it was when I was diagnosed, when I found the lump and then was told that I had the cells were cancer, I had like 100% didn't know, it's interesting, I 100% didn't know how to do Western treatment, and I 100% didn't know how to not do it.
Okay.
Like, I was so scared, and what became amazing and overwhelming was that I researched all the options, and I was like, oh my God, there are so many.
Mm-hmm.
And then when I really started to dig in the options that we know or are told, like, this is exactly what you do from a Western treatment perspective.
The three things.
Yeah, surgery, chemo, radiation. When I started
Surgery,
digging,
chemo, pharmaceuticals, chemo, drugs.
Yeah.
Same.
yeah, when I started digging into the history of it, and then when I actually heard from an oncologist that they don't know how chemo works, it became a mind F.
Yeah.
And so I honestly became very overwhelmed by the unraveling of anything could work. And nothing could work. And like there was so much
Right.
that it became overwhelming. And so I chose a lot on my journey, right? Like I stopped chemo. I had gotten to a point where I couldn't open like a water bottle with my hands because I had neuropathy and my feet were burning and my immunity had gotten pretty low. And I did have
side effects of chemotherapy.
Yes. And I had a conversation with a nurse who, along the way, she had been kind of my compass too.
Mm-hmm.
Like we talked about all the other stuff that I was doing outside of.
Which included?
I mean, a ton of stuff. Like I started my morning with gratitude, sending notes to people I loved, journaling, meditation, all sorts of nutritional and food-based stuff that I was doing also. At that point I was really into bone broth too, and like making sure that my digestion was as strong as it can be because chemo can
Destroy your microbiome.
Exactly. I was going to say, destroy your gut bacteria microbiome. And she gave me she just said, you've had a lot of chemo. And she said, if it's something that you feel ready to, like it's your choice, basically. And I just was like, yeah, I'm done. And this is one of the most interesting things, like I think when people talk about levitating, I'm like, oh, I actually know how levitation feels. Like in my chair, I was like, I think I just lifted off of my chair.
Yeah.
And I walked out to the chemo room and I was like, let's go, Mom. And one of the nurses was like, you gonna ring the bell? I don't know if you know about the bell, but when you finish chemo, you get to ring a bell. And since day one, I was like, no way, I'm not ringing the bell. This is not the celebration. Anyway, it was a celebration. So yeah, I finished. At that point, I walked out knowing that I was done with Western treatment. I considered radiation. I went through with learning about it. I also knew that even though I was told it could be protected, that the space that they would be targeting was really close to my heart, and I knew that chemo is also really hard on your heart. So it's this balance of
What was going to be your...
Well, it was also just a balance of like, the point was to make your life longer, and then also the side effects of, like the chance of living longer if you take these medications is higher, and then the possible side effects of them is also possibly going to shorten your life. Does that make sense? Mm-hmm. So it's like this balance of like...
risk versus benefit.
Yeah. Anyway. So then I went on a journey of, I did all sorts of stuff. I did energy healing. I did,
Yeah.
I'm like, oh my gosh, there's so much
So
that I
much.
could go. And then in the end, really what happened was I decided, well, I also asked a nutritionist I was working with, I was like, listen, this is a lot of managing life and not, like I was ready to just live, and not just be making every decision out of fear of dying.
Yeah. That happens a lot in medicine and in healthcare when you start identifying, and I actually had this realization thanks to one of my kids, one of my pediatric patients, my buddy. We didn't take care of type 1 diabetics on the caravan, but I had history of working with insulin pumps, and so I had she had come to me for like colds and stuff, but at one point I had to titrate her insulin pump, and I think she was like 9 or 10, and I made the mistake of the first thing that I asked her was how many times have you been low, or how many episodes have you had, and she was just like, I'm not just a diabetic. Like, I have a life. And I was like, you do have a life. Absolutely, 100%. And I was a way better pediatric PA than that, you know? Like I played with kids before I saw them for their visits, and I was like, oh yeah, when you as a practitioner identify and the patient identifies, then it's like you forget about the rest of life. Like
Yeah.
this is just one like tiny little polka dot in this entire body and experience.
Yeah.
But it becomes you.
everything. Well, it was
Yeah.
all encompassing, and that's the thing that is so amazing. Like, there's so much you can do, but there's so much you can do, right? So you can just become
Overwhelmed.
Yeah. So there was one of the nutritionists that I was working with. I was like, hey, here's the deal. Like, I'm doing this support, like everything that you've recommended, definitely through chemo. But as life goes on, like, what is the most important focus for me? Like, what can I do? And he was like, take immunity mushrooms. I was like, sweet.
That's easy.
Yeah. And so slowly, as I realized that like part of my journey was trusting myself and choosing to be here, I was able to let go of some of the rigidity.
And it's really rigid in the science and medical world.
Yeah.
Because
Well,
it's safe to be rigid and in a box, right? Because that way it's researchable, it's controlled,
Yeah.
it's replicatable, it's in this space where we can just continue to study it. And that's not what life is. Life is vast and expansive and constantly changing and
Fluid.
fluid.
And not linear.
Yeah.
Yeah.
And for M, it was all those things, and also, and mostly, right, like following your inner compass, like following which step, okay, this is what I need to ask Glenn about. I don't want to take all these things. What can I do? And then the meditation and the gratitude. But for some, I know people that got a diagnosis, said, okay, I will go through all the treatment that you tell me to go through, but I'm going to take a month and I'm going to go walk in nature.
Yeah.
And when he came back, they did the tests and he was free of cancer.
I love it.
There's Chris Beats Cancer, who does
Juices.
Is it juices? Okay.
I think he's a big juice guy.
Okay, so there's like the juicing, there's the aggressive nutritional therapy, there's people who've done chronic healing. There's just so many paths, and that's why the medicine inside is the most important thing when you get a diagnosis, like anything.
Well, I think and I'm going to bring up our current situation where we are in life, right? Like, for me, the biggest awakening was that I had to trust myself, and that was scary as,
Yeah.
you know, because you have all these like experts and physicians and scientists and telling you that this is the way you have to do it. And there's a lot of fear involved in it, right? Like, there's a lot of
fear turns this part off. It turns off your frontal lobe. It turns off the rational, logical, reasoning center of our brains.
Yeah.
And it turns off our hearts and our guts.
Yeah.
Because we're just trying to survive.
Right. And that's definitely where you can be when you have a diagnosis or hear a diagnosis like that. And in the end, yeah, I mean, I slowly just kind of stepped away and realized more and more, like, one of my best questions was, who am I doing this for? Like, am I doing this for me? And it took, you know, that's a lot of what unraveled. Like, I wasn't doing it. Each choice more and more, I was like, am I doing this for me? Or am I doing it for someone else? Or am I doing it for, you know, this institution? Or am I doing it for, and more, as I made choices, I was like, I have to do this for me. Like, this has to feel good for me. and to further more and more trust in that was, I get it. I get that it's really mind-blowing to say something like stepping away from chemo may not make sense to all these people, to all these ways, and to really sit with that and be like, I am going to trust myself that, like, this is the decision that I made, no matter what the outcome is.
Yeah. Okay. So that was the shift in M's life.
Yeah.
And I believe that it doesn't have to just be disease or
Mhm.
illness.
No,
Like
we don't need that.
following your inner compass and your gut and your heart in all things in life,
Mm-hmm.
despite what the outside noise says
Mm-hmm.
and the outside experts, and is going to
You're the
allow
expert
you
of you.
to maybe levitate.
I know, right? Oh my God.
And it's like an actual physiological feeling that happens. There's like this lightness of being that occurs when you follow your spirit, your heart, your soul. So thanks for joining us, and thank you, Em, for being bold.
Thank you for
Yes.
inviting me and encouraging me to be, and thank you for allowing me to remember my levitation feeling again.
Yeah.
Yeah, that felt good.
All right.
Okay, we love you.
We love you.
And this is, oh, are we gonna put this on the YouTube?
We're gonna put this on something. Okay.
Well, yeah, keep following us wherever we are because we love you.
Yeah.
Or following us, watching us, seeing us.
Hearing us.
Boom.
Levitating with us. Bye.
Levitating.